Hello, my name is Lauren, and I will be discussing the disease process and pathophysiology of syphilis. Syphilis is an infection caused by Treponema pallidum. The causative organism of syphilis was first identified in 1905. In the United States, syphilis has been a nationally recognized disease since 1944. The transmission of the spirochete usually occurs through direct contact with infectious open lesions during sex with organism present. T. pallidum can initiate infection wherever inoculation occurs, which this means that any contact with infected secretions to any tissue can lead to a primary lesion. Syphilis can be spread by kissing or touching a person who has an active lesion. This could be on their lips, oral cavity, breasts, or genitals. The lesion is very infectious with efficacy of transmission estimated at about 30%. The organism can also cross the placenta, resulting in fetal infection. It is rarely transmitted through blood transfusions or transfused blood due to donor screening, and the organism is unable to survive longer than 24 to 48 hours in the environment the blood is stored. Syphilis progresses and it has 4 major stages, which I will discuss further. If it's left untreated, clinical symptoms and presentation will vary depending on what stage of the disease the person or the individual is at. The pathophysiology of syphilis, the infecting spirochete penetrates an intact mucous membrane or abrasions in the skin. It enters the lymphatics and blood. The incubation period averages about 21 days, but can range 10 to 90 from time of exposure to development of lesions. Systemic infection, and so systemic infection takes place as the primary lesion develops at site of inoculation. Organ involvement occurs from dissemination. Due to patients presenting with a wide range of symptoms, syphilis is divided into early and late infection, and the progression moves through these stages, which is primary, secondary, latent, and tertiary. Early syphilis compromises primary and secondary syphilis, and late syphilis is when the infection is left untreated during the earlier stages. I will discuss the stages. Primary, the ulcer on the infected site, the incubation period is typically 3 to 6 weeks. The lesion begins as a papule at the site of inoculation. Secondary, the development is 4 to 10 weeks after appearance of primary lesion. Comparable to primary, there's acute manifestations that can resolve spontaneously and even in the absence of treatment. Latent is absence of physical signs and symptoms, with the exception of possible reoccurrence of mucocutaneous lesions that resemble those of secondary syphilis. And it's typically in the stage latent, obviously meaning asymptomatic. Tertiary, this is where organ damage develops. Systems include cardiovascular system, CNS, central nervous system, or gumatous syphilis in individuals with HIV. Some risk factors: unsafe sexual practice, multiple sex partners, exposure to infected body fluids, IV and illicit drug use, and I'll just cover a couple more: existing sexually transmitted disease or HIV. Some major signs and symptoms, I'll go through a couple for each each of the stages listed below. So primary, genital, or oral ulceration, typically painless, unless lesions are seen in genital herpes. This is, there's some local lymphedema. Also, what's important to know is that single or multiple, and it heals without treatment. However, treatment can prevent progression of second stage. Secondary, they still may be, an individual still may be asymptomatic. This can produce a wide range of symptoms. I won't go through all, but one of the most predominant symptoms is a rash. That is a rash all over. It can be found on the palms and the soles. This is the most typical sign. Like I said, it can mimic a rash of measles. Also, you can have fever, headache, sore throat, alopecia, to name a couple more symptoms. For latent, as I mentioned before, asymptomatic, tertiary, these are more of your late clinical manifestations, and they vary. And you can see, as I mentioned above, where I mentioned the cardiovascular syphilis, this occurs at least 10 years post primary infection. You can see that it's associated with aneurysm formation in the ascending aorta. You can see where you can have for the neurosyphilis, it's affecting the tissues, the meningovascular tissues. That's where you're seeing your more psychological difficulties. And this can cause some paranoia, delusions, hallucinations. So some diagnostic testing. You can see here the rapid, this is a dark field that identifies the organism from lesion to exudate to provide an immediate syphilis diagnosis. You can see what I wanted to really highlight here in the late 2014, the FDA granted clinical laboratory improvement amendments waiver, and this permitted the use of rapid tests. And these tests are done by a finger stick and is called a syphilis health check, and it can be based on used in a wide variety of clinical settings. You can see below a lumbar puncture for the CSF analysis identifies neurosyphilis, as you can see there. And for imaging, you can see a chest x-ray may reveal some aortic dilation in late syphilis. Thank you very much, and I hope you enjoyed.